submitting an application for the level of quality. Then the application is reviewed by TCIM from now that it thinks the documents are in order and that they are authentic. And then this is done in collaboration with the Ministry of Health Division of Alternative Medicine. And then we then make a division on whether to register the practitioner, and then we issue a letter of authority, which is signed by the CEO and register. And then this letter is supposed to be renewed annually until then, for as long as the other authority has their so we total registered about it's 40 practitioners in TCIM, and these are the different areas they fall under. And so some of the challenges we have in regulation include the regulatory gaps. So where there is weak monitoring and enforcement, it leads to properly unsafe practices and unregistered practitioners. Then we have product registration and approval gaps, although this falls under a different authority to regulate this. Then we have challenges in terms of evidence and standardization due to limited scientific validation, quality, safety of the therapy. We also have integration barriers, which arise from resistance by conventional medicine practitioners, integration of product theft, and lack of insurance coverage for services offered by TCIM practitioners. And finally, we have capacity issues. We have few training institutions and models, and insufficient funding for research into these alternative medicine practices. So, in our view, a robust regulatory system would have an overarching policy support it, and clearly defined legal framework with laws and regulations to support the regulation, a competent authority that is designated as a regulatory body to provide oversight and enforcement. There should be compliance mechanism for identification of potential dangers, non-compliance risks, and indicators, monitoring and reporting to track the practice, regulatory changes, and report on to ensure accountability. Documentation and auditing to maintain detailed records and perform regular audits to verify compliance. Resource allocation, adequate budget and skilled staff to manage the regulatory obligations, and stakeholder communication to inform stakeholders about the regulatory policy developments and enhance this. So our proposal for the way forward is that we need to strengthen the legislation around the practice of TCIM. And in this case, the traditional health practitioners group to establish clear registration mechanism and disciplinary mechanism, enhance collaboration with other regulatory authorities, which will support training and referral, build capacity by investing in research and promoting training programs and public awareness campaigns, financial integration. In this case, our national social health authority should consider incorporating TCIM in the pregnancy package and monitoring evaluation with other national database and outcomes. Thank you.
very much, Dr. Stella. You've managed to save us time. We argue, we put our hands together again. Next, let us go to Kenya. Coming to Tanzania, and from the perspective of the Healers Council by Dr. Mark Odin. You are welcome.
Yes, good morning. That is Asui. So my name is Mark, and today I will be talking about our traditional and alternative practice council. That I will take through the operations that we have and the achievements that we have achieved so far, but also the challenges that we are working on. So, as I recalled yesterday on the history, 1990 is where traditional medicine was shifted to the Ministry of Health from the Ministry of Culture and Sports. And on the same year, it was incorporated with the National Health Service. So, starting end of 1990, so 1999, 1998, up to 2000, the initiative to develop the law of gadget, where in 2002 the government enacted the Traditional and Alternative Rights Medicine Act number 23. And in 2005, then we had the Traditional and Alternative Rights Practice Council. So now it's around 20 years, 21 years, 21 years since we have established. So in Tanzania, we have about 75,000 traditional rights practitioners that are recorded in the official document, but it's like more than that. And when we talk about the composition of the council, so we have members of the council. So the members of the council will have a chairperson who had a knowledge on traditional and alternative medicine. And we also have members from the Attorney General, who is the legal officer. We have 4 registered traditional practitioners, including the traditional base attendant, but we also have 2 registered alternative rights practitioners. So in total, it's like 80 members. And on the appointments, the chairman is appointed by Honorable President, and other council members are appointed by the responsible minister. And in terms of the tenure of the office, of course, each council, it is stayed for 3 years, but they are eligible for the appointment for another term. Also, we have in the office area, we have the register of the council. This one is appointed by the minister and is a public officer, so it should be employed by the government. But he also is served as the secretary of the council and other committees. We have 3 committees. But he also register also oversee the secretariat, who are also government employees. So mainly the council has a number of functions, but mainly is to monitor and regulate traditional and alternative rights practice in the country, but also to promote and support the development of traditional and alternative medicine in the country. So on standing committees, there are 3 standing committees under the council. So we have academic committee that is responsible for a number of things, including identifying and approve training institutions, review and approve training curriculums, But also we have professional conduct committee. So this one reviews cases related to misconduct, professional reputation, and offences, and they advise the council to take the action. But also we have research and development committee. Among other responsibilities, but is also responsible for registration of traditional medicine. So before the council register traditional medicine, then the application should be discussed by this committee, and then the government is advised either to register or not to register that medicine. So in terms of regulations, in 2008, we developed 3 regulations. So one was a traditional hypnotic medicine code of ethical conduct and practice, where there is a number of things that are articulating this regulation, including issues of professional accountability, liability of misconduct, issues of prevention of sexual abuse. So, for example, when you attend a practitioner is a male and is attending a female, so need to have an aide who is a female to do that. On the issues of under 18, the children, they need to have an adult who is supervising and they are together in terms of examination of the patient. But also the issues of regulation and control of advertisement. So before you make any advertisement, then you need to apply for the permit from the council. So in the code of practice, actually here it went on highlighting on the issues of dispensing, recording, administration of traditional medicine. So the medicine should be recorded appropriately, it should have expired date, and so forth. So another regulation is on regulation of material medical. And this one emphasizes much on the traditional medicine itself. So protection of medicinal plants and other natural resources of medicinal value. How much you need to harvest per single visit in the bush. Also, issues of protection of intellectual property. So you are not allowed to produce others labeled medicine or identified medicine without permission. So you need to vote for permission, and then you can produce. There are issues of registration of practitioner in the health facility regulation, and this one focus on registration of practitioner in facility. So in order to be registered as a practitioner, there are conditions, but you need to stay in a single area for not less than 3 years. Then there are meetings at local government where they discuss your application for approval and up to the council. And this also is being done by online system. So we have online system for registration on our practitioners. But for the health facility, this goes to dispensary up to the hospital, but also shops for selling medicines. So as a council, have a lot of things to do. We have about 180 districts that the council is supervised. So they have decentralized their responsibility to the regional and the district levels, where the regional and district medical officers, they have a designated person to coordinate activities of traditional medicine. So in 2010, when we talk about the milestones, we started registration of traditional and alternative health practitioners in the facilities. In 2017, we started to register traditional medicine, and about 4 years ago, we started to register this practitioner on the online systems. So just a highlight in this financial year. So since we started up to this financial year, we have managed to register 60,618 practitioners, but we have registered 2,093 facilities. But also, since 2017 up to date, we have registered 151 traditional medicine. But in this financial year, we had 4 cases, professional misconduct that were reported, and we managed to deal with them. So, post-market surveillance, By regulations on multi-medical, we are required to do post-market surveillance for those drugs that we have registered. Actually, the first one we did in 2021, where the findings were 2 cases of the medicine had a microbial contamination, and 1 drug was adulterated. So this 1 drug was deregistered, and these were educated on how they can improve to ensure that they are not contaminated. So they are supposed also to repeat. So 2023, and this last year we did, but it still is on analysis. So we have some challenges, issues of resources, issues of lab capacity, especially on efficacy, but also on protection of medicinal plants, as well as still we are lacking funds for research and development. So thank you very much for listening.
Thank you, my brother. And still, I request we join our hands together for him. I have really appreciated the human resource capacity the traditional healers can offer in health.